day, sir. I'm Aramiti Pacana, Polytechnic University student of nurse. I'm going to perform oral care. Mouth care is defined as a scientific care of the teeth and mouth. The purposes: to keep the mucosa clean, soap, moist, and intact. To keep the lips clean, soap, moist, and intact. So to prevent oral infection. To remove the food depress and well as a dental plaque without damage the gum. The alleviate pain, discomfort, and enhance oral intake with appetite. To prevent halitosis or relieve it, the fresh the mouth of the patient. Equipment required for this oral care is tray. 1. Gauze padded tongue depressor. 2. Suppressed tongue torch. Appropriate equipment for cleaning. First, toothbrush, foam wipes, gauze pad, tongue depressor, cotton balls with artery forceps and dissecting forceps, oral care agents, toothpaste, antiseptic solution, assisting the client with oral care. Suggested action. First, explain the procedure to the client and the principle and rationale, providing information, roster of operation, understanding, and participation in care. Ma'am, I'm Aramiti Pacana. Ma'am, may I know your name or you state your name?
My name is Arlene.
Your age, ma'am? Okay, ma'am. Now, lilinisin po natin ang iyong mouth para sa inyong mabuting kalagayan. Okay lang po ba? So, collect all instrument required, organization, facilities, accurate skill, performance. So the all equipment is in one side of the bed. Close door or put the screen to maintain privacy for the patient. So the door and the curtain is already closed for the privacy of the patient. So perform hand hygiene and wear disposable gloves if possible. So I'm going to use alcohol for hand hygiene and to disinfect the infection. And I'm going to use gloves. So, if you use solution, prepare solution required. Solution must be prepared each time before used to maximize their efficacy. So, assess the client comfortable upright position or sitting position to promote his or her comfort and safety and effectiveness of the care, including the inspection and assessment. Inspect oral cavity. Inspect full the cavity such as teeth, gum, mucosa, and tongue with the aid of gauze padded tongue depressor and torch. Comprehensive assessment and essential to determine individual needs. Some clients with anemia, communication depression, diabetes, renal impairment, epilepsy, and taking steroids should be paid attention to oral condition. And B, take note if you find any abnormalities, bleeding, swollen, ulcer, or sores, etc., that they may have complication in oral cavity. mouth of the patient is no abnormalities, then place face towel over the client chest or on the thigh with rubber sheet to prevent the clothing from the wetting and not to be give uncomfortable condition of the patient. Put kidney tray in hand or assess the client holding the kidney tray to receive disposal shortly. So, instruct the client to brush teeth. Points of the instruction: client place the toothbrush at the 45 angle for the teeth. Effective dislodging the strips with the distropal flap from the teeth and giggle guarding. So, pwede po. 45 angle lang po, ma'am. Client brush in the direction of the tips with the brush under the gum, line with toothpaste. Rotate the brittle using a vibrating or jiggling motion until the outer and inner surface of the teeth and gum are clean. Client brushes meeting surface with the of the teeth. Client clean tongue from the inner outer and avoid posterior direction. To cleaning the posterior direction of the tongue may be cause of the gum reflex. So, ma'am, pwede po. So, paki-brush po ang iyong teeth. Round po muna. Then, up and down. And next po, ma'am, your gum po. Inner and outer. And your tongue. Inner and outer. Okay, ma'am. So, if the client cannot tolerate toothbrush from the swab or cotton balls can be used when the client's prone the bleeding and the pain. Toothbrush is not advisable. So, ask the client to rinse with the fresh water and void content into the kidney tray. Okay, ma'am. Ayan. Advice here not to be swallow water if needed. Sexual equipment use be remove any excess to reduce potential for the infection. So, ma'am, meron po po. Wala na po ba? So, ask the client to whip mouth and around it to make a comfort and provide the well of afference. So, ma'am, pwede po. Confirm the condition of the client, teeth, gum, and tongue. Apply the lubricant to lips to moisturize lips and reduce risks from the cracking. So, ma'am, going to do it now. So, ma'am, I'm going to use Vaseline lips therapy for your lips. So, rinse and dry toothbrush thoroughly. Return the proper place for the personal belongings after drying up, and to prevent the growth of the microorganism. replace all instruments to prepare equipment for the next procedure. Discard dirt properly and safely to maintain the standard location. Remove gloves and wash your hands to prevent the spread of infection. So I'm going to remove my gloves. And I'm very comfortable. So document the care and sign of the record. Documentation provides on the going data collection of the patient for the condition of care. Now I'm going to record the data of the patient. So the data of the patient is already normal findings. No abnormal findings with the mouth, and repeat any findings to senior staff. So let me assume the document is and provide to check the senior staff.